Good morning.
Good
I'm here
morning.
with Narcissa.
Hello.
Narcissa has been a patient of mine for several years right now.
Yes.
And I'm going to ask her some questions about her experience here at the office and the experience with her surgeries. When you first presented to the office, what was your main complaint?
My main complaint was that I couldn't barely walk. Actually, couldn't walk.
Couldn't walk at all.
Mhm.
And who did you see initially?
I initially saw you.
Okay.
I saw the front desk, of course, and then I saw you.
So you initially saw me, and I told you about your diagnosis of the avascular necrosis,
Yes.
which is where the bone dies in the hip.
Yes.
Eventually we came to a decision
Yes.
about surgical intervention.
Yes.
How was your experience getting up to that date? How were you treated by the office?
The office was great, excellent. They're very, very friendly. I like early appointments, so therefore you would think that they would be kind of like grouchy, but they weren't. They were just as cheerful and jolly as I am. And but one of the things that I really truly loved about you, honestly, was that you didn't immediately want to do surgery.
What did I want to do on you initially?
You initially, we started off with the pain, and then you wanted to start off with shots, and then when the shots and things didn't work, and then my leg literally just like gave out, you still didn't want to go into the surgery because you actually wanted to send my x-rays to a specialist in New York.
Mm-hmm.
And I thought that was awesome.
Yep. I wanted to get another opinion to make
Yes.
sure that what we were proposing to do
Yes.
was your best option to provide your best outcome.
Yes. And I just thought that was great. I mean, you're very, very caring, that I loved. And I don't know if this is something it'd be okay for me to say,
You
but
say whatever you like.
this was very touching for me. I had just recently was diagnosed with HIV, and I was very, very nervous. And you were actually the first doctor that I had to tell, and you didn't make me feel like crap. You were like, okay, all right, okay. And I mean, you didn't make me feel like I wasn't less than something.
You're not less than something. Everybody is something, and everyone deserves to have the best outcome and caring that there is. You're no different than anybody else. You just have a bad disease, and you're handling it well.
Thank you very much. Okay.
So,
Sorry, but
eventually, Narcissa underwent a procedure where we did a hip arthroscopy, and we put in a specialized metal object into the hip to decompress the hip to help the bone try and heal. After surgery, she ended up going to physical therapy. How was your experience in the whole surgical atmosphere and your post-operative care and your physical therapy?
well, I have to back you up first.
Okay.
I have to back him up first because we skipped that before I did the total hip.
Yeah, I'm still on the arthroscopy. I haven't gotten to that part yet.
No, my partials.
Oh, okay.
You
But
gave
those
me
were-
that option as well.
Right,
That was another option as
That
well.
was one of the
That was
options
option,
to
yeah.
do. We talked about doing something called a resurfacing procedure, which is a partial hip, where you just take off the cartilage on the end of the bone and put a cup and a cap on to preserve as much bone, because she's young, and we want to preserve bone so that in the future there's other options. So eventually we went through surgery, and
Yes.
you did your physical therapy, advanced physical therapy, or
Yes,
freehold.
yes.
Who'd you work with specifically?
Charles and who's in charge?
Karen? Patty Buck.
Patty. Yes.
And how was
Those
your
are the-
how was your experience?
Awesome. They were really, really nice, very caring. They take their time, and if you have a question, even though you have your doctors, but then if you kind of like curious about something, you'll ask them, and they'll do their best, but then they will direct you back to the doctor.
So one of the things that advanced physical therapy promotes is what we call physician-directed care.
Yes.
The ability to talk to the physician who are on site and promote care on a daily, weekly basis rather than the interim when you see the doctor. Did you find that to
Right.
be true?
And what else is awesome as well is because they're right next to one another, if you have a problem and they think it's something that's serious, they will like immediately say, wait a minute, and then they can talk to your doctor because you're you're right next to each other. And I thought that was awesome because Patty had a question of something that was on my prescription, and then I had a question as well, and she said, well, you know what, just wait a minute, you know, if they're busy, I will definitely get back to it. And I thought that was awesome.
Eventually, you would end up having 2 hip replacements. How are you doing now?
Excellent.
Excellent. Okay. Show me. Oh, she's wearing quite high heels.
Wow.
Which I did not expect. And very, very stylish. Court heels. You're back doing everything you want to do?
Yes, I am. I mean, it's a little different for me than probably other patients because I have a back situation.
Yeah,
So mine's
and
is a
we've been
little
dealing with
Yes.
her back situation for a long time, from starting with Dr. Cardamone originally
Yes.
treating you, and now other physicians. So the toughest question, and I think you've already answered this, what differentiates your experience at Advanced Orthopedics and Sports Medicine Institute from other physician practices, or from what you've heard about other practices?
Okay, I can say that I had a car accident many, many years ago, and I was going to a orthopedic up north. And the difference is the caring. There is, they make you feel like family.
Make you feel like you are the
That
only
you're a
one.
part.
You're a part of our corporation.
Yes.
You're not just a number.
Yes,
You're
exactly.
you're a person.
Yeah.
Well,
Definitely agree on that.
and I think that's what most of us strive to be, and I hope that's why we all went into medicine.
Yeah, well, you guys are, it's more than, put it this way. You can go to a doctor's office and you can tell if a doctor is there, and I've seen many. If you're going to a doctor's office and you can feel as if they're caring about you or if it's about the money. I never ever once felt that it was about the money here.
Thank you.
You're welcome.
It always is about the patient. I
Yeah.
strive for customer care.
Yeah.
I want this
And it shows.
to be a patient-centered, patient-focused atmosphere, and because that's why you come here. That's why we're doing what we do. I thank you for coming in here and sharing your experiences with myself and anyone who views this video. I appreciate it, and I hope I continue, for as long as I practice, to provide the same level of care that you come to expect from me.
You will. I know you will.
Goodbye.